Yes, my topic for my presentation is menopause in Nigeria with emphasis on early and premature menopause. I've looked into this project over a period of time and I've decided to put it into sections. Introduction, prevalence of menopause, stages of menopause, psychosocial and physiological syndromic views, expected age at menopause, factors influencing age at menopause, symptoms of menopause, treatment of menopause, recommendations and conclusions with the relevant emphasis on references. In the introduction, I want to define menopause. Menopause is the cessation of menstrual flow in an adult female of reproductive age within a period of cessation of menstrual flow for 12 months. This usually occurs within the age of 50 to 51 in the developed world, but could be earlier or a little bit later. Menopause occurs at specific ages in developed world, 51, but in the developing world or in areas where you have a lot of traditional and cultural influences on childbirth and menstrual flow, menopause is a little delayed, it could be longer. Early menopause is menopause occurring around or below the age of 40. Premature menopause is different from early menopause. Early menopause is cessation of menstrual flow for 12 months before the age of 40, while premature menopause is menopause occurring much earlier than early menopause. Could be at the age of 30, 35, thereabout. The differences in menopause between the developed and the developing world, like I said, is essentially based on age differences, lifestyle, exposure to some factors, therapeutic treatment, for instance, for ovarian cancer, hysterectomies, use of pharmaceuticals and drugs, side effects of chemotherapy. Those are influences, things that influence menopause. In early menopause, which occurs on or around the age of 40, it occurs when, for instance, a lady undergoes hysterectomy, radiotherapy for carcinoma of the ovaries. It could also occur in cases of tuberculosis. In some cases, it is also associated with filariasis in Africa, particularly. Authors and researchers on menopause have divided menopause into 3 phases: pre-menopause, perimenopause, and menopause. It is often said that pre-menopause is menopause occurring. Premenopause is the period spanning from when adolescence and menstrual flow has commenced till about when menopause occurs, while perimenopause is 12 months before and 12 months after menopause. The actual incidence of menopause itself is when menstrual flow has completely ceased. Psychosocial and physiological syndromic views. There is a lot of diversity of the menopausal experience. In the developed world, menopause is seen as a condition which affects birth, deliveries, and in some cases causes depression in women, particularly when it occurs earlier. Whereas in the developing world, women see menopause as part of the usual changes in body as they get older. Women in Africa do not attach any significance to menopause. The same thing with women in India. In Indian villages, they do not attach any significance to menopause. They just see it as one of those occurrences which comes up as they age. And that is also associated with racial, ethnic significance. That is why in this environment in Africa and in Asia, India, women do not have much psychosocial attachment to menopausal changes. Whereas in the developed world, women they have depression, they call it the blues, they have the blues, and they have hot flushes. All of that is associated with the perception of menopause. As mentioned earlier, there are a lot of medical conditions that influence menopausal occurrence, the stage at which menopause occurs. Women taking medications, chemotherapy, women taking medications for tuberculosis, could be tuberculosis of the lungs, but mostly tuberculosis of the abdomen. Women taking treatment for that could also go into menopause. Women who have had hysterectomies, women who have had one operation or another associated with the uterus, ovaries, and associated organs or connected organs also have menopause occurring earlier than anticipated. The relevance of the study of menopause to the population is that if menopause occurs earlier, it is relevant to know why it has occurred earlier. Because if a reason is known why it has occurred earlier, that reason can be addressed medically, thereby restoring the woman back to her menstrual flow and the possibility of getting pregnant. Particularly in Africa and in Asia, childbirth is viewed with a lot of attachment. People want to have children, and as such, if the cause of primary or secondary infertility is early menopause and it is addressed, then the problem can be solved. That is the relevance of this study. That's the relevance of this study to the population. Again, the study of menopause shows that there are a lot of psychosocial attachments which are involved. And these psychosocial involvements may not be attributable to menopause in some cases. Whereas if they attend the proper menopausal clinic, it is able to elucidate that these individuals are in menopausal phase, and you can then address that either with hormonal supplements, addressing the depression, and possibly counseling. That is the relevance of the study in terms of how it relates to the population, the study population. Again, menopause, a lady might not know she's in menopause because the menstrual flow, before it completely ceases, might be on and off. Menstrual flow begins to wane gradually until it ceases, and during that period, a lot of menopausal symptoms could also occur. Some authors and some researchers also argue that men have what you call andropause. Andropause is a condition which is associated with lethargy, lack of sexual performance, inability to concentrate in men and all that. But other authors also argue that there's no such situation as andropause in men, and that if the causative factor is addressed, the situation can be addressed in men, and do not believe that there's anything like andropause. Again, in women, some of the presenting conditions could also be addressed using different types of method of treatment. I will come to that shortly. We will look at issues of hormonal supplements, topical treatment of creams, particularly for vaginal dryness, and restoration of... Yes, please.
You have only 3 more minutes left, so you can just...
3 more minutes.
Yeah, only 3 more minutes.
There are other familial factors and genetic factors associated with menopause. It is assumed and believed that women have number of eggs that are laid down at menarche when women start menstrual flow are defined, and as such, the eggs are released every month, and at a particular time, the amount of eggs are exhausted, and as such, menstrual flow will cease. Menopause is also affected with lifestyle, like I said. Commonest effect is smoking. Smoking can cause, it's associated with reduced age at attaining menopause by 1.8. I have mentioned before the influence of pathology on the age at menopause. Pathology could be ovarian cancer, hysterectomies, and things like that. Symptoms of menopause include hot flushes, night sweats, headache, palpitations, dizziness, forgetfulness, irritability, nervousness, loss of concentration, and other causes and other presentations. And there is a climateric scale. The climateric scale is able to outline all of this into a format. Treatment methods involve oral preparations like cream pack, transdermal implants subcutaneously, local vaginal estrogen creams, vaginal rings, skin patches, nasal spray, gonadotropins. Recommendations and conclusions: advocacy for introduction of referral menopausal clinic, policy guidelines through government agencies, and enlightenment campaigns. That is the end of my presentation. Please refer to my references as outlined. References: Barlow, Signum, Mauritius, George T., Women in Southern Indian Village, Greenwell, Edgar, Menopause Determined in Utero, Age is Determined at Utero, Green, G., 1999, The Meaning of Menopause, Hillard, Recommendations for Estrogen and Progesterone Replacement in the Climacteric and Postmenopausal, Mauritius, World Health Organization Research in Menopause in 1990, Report of WHO Scientific...
Mr. Nanna, your time is up. Hello, Mr. Nanna. Thank you so much for your presentation.